Aspects of Clinical Malpractice in Endodontics by Alrahabi et al. In 2019 in Saudi Arabia. Medical malpractice is an act of a medical professional deviating from the set regulations and standards that result in an injury or damage to a patient. The number of reported malpractice cases has increased remarkably in recent years among many parts of the world. Endodontic malpractice claims have commonly been reported in 14 and 17% of Swedish and the USA population respectively. The aim of this article is to highlight various aspects of malpractice in clinical endodontics and associated materials and challenges. In addition, commonly occurring operating errors during endodontic treatment and possible consequences have been discussed. The endodontic errors categorization. The typical injuries in endodontic malpractice are the perforating and broken instruments. For the ease of understanding, endodontic errors can be classified into preoperative, intraoperative, or postoperative error. According to Bogerndal and Reed, the endodontic malpractice claims were subcategorized as follows: technical complications as a result of an improper treatment, persistent pain, wrong treatment, prolonged treatment, lack of information, and others, which includes the unnecessary endodontic procedure based on a false diagnostic or non-endodontic problems. For the preoperative errors, such as the incorrect diagnosis that usually leads to a misinterpretation or lack of information. The intraoperative errors, as working without the rubber dam, as a negligence for the isolation and the control of the cross-infection. Root canal and pulp chamber perforation, which usually caused by iatrogonic due to the improper use of endodontic instruments while accessing the preparation of a cavity and exploring the root canals. Such kinds of serious implications are reported in 2 to 12% of root-treated teeth. Ledge formation. The most frequently reported complication during endodontic instrumentation is the deviation of the canals from its curvature. Hypochlorite accidents. Several chemicals have been explored for the root canal irrigation, as sodium hypochlorite or even the calcium hydroxide. Separated instruments, which is the fracture of an endodontic instrument as a file or reamers inside the root canals. The fracture rate of the stainless steel instruments have been reported significantly lower, with 0.25% and 6%, compared with the fracture rate of the NiTi instruments, which is 1.3 to 10%. Aspiration or ingestion of endodontic instruments that can be avoided by proper precautionary measures. Post-operative pain. According to a meta-analysis, the post-operative pain has been estimated in 5.4% of patients. Avoiding this malpractice injury during the endodontic therapy, the most important consideration involve adhering to the standard guideline and protocol while conducting the endodontic treatment. The vast majority of injuries resulting from malpractice of endodontic treatment were deemed avoidable. Also, one of the most crucial factors in preventing endodontic malpractice by enabling the practitioners to diagnose, plan a treatment, and perform endodontic procedure with the desired prognosis. The medico-legal aspects. Most of the countries will require proof of negligence, damage, and the causal connection between the act of negligence and the damage caused. The focus usually will be on the causation and the damage factors, the proof that the claim's injury was caused by a specific claimed medical treatment and not from other reasons, and the proof of the damage. As a conclusion for this paper, the operator must consider ethical principles of clinical practice and adhere strictly to the standard of healthcare while performing the diagnosis and treatment. The operators as well must consider continuing professional development, including hands-on workshops, seminar, refreshers courses, and training on using various endodontic devices.